We're going to see the strawberry hemangioma. Strawberry hemangioma is a red hemangioma that is seen in pediatric patients. Usually is present at birth and regresses spontaneously. So there will be a proliferative phase and a involution phase. The proliferative phase begins at birth, and the involution appears or began after 6 months of age, usually at 9 months, 1 year. And at 5 to 8 years of age, there is complete involution of the lesion. So this would be a red or violet lesion that is regressing, and here would be a raised plaque that is growing and red color. Alright, now for most of the strawberry hemangiomas there is only need to observe, just observation, but for high risk, let's say high risk lesions, we can give beta blockers. These lesions would be if there is a large facial strawberry hemangioma or segmental strawberry hemangioma, or growing rapidly with ulceration and scarring, or if there is visual impairment. This would be because the strawberry hemangioma is periorbital. If there are hemangiomas in the liver, this could lead to high output heart failure. Or if they are in, let's say, in the cervicofascial or other things like produce obstruction of the airway. So in this situation we give beta blockers. Now for special considerations, that is, if the patient has, for example, more than 5 cutaneous strawberry hemangiomas, we need to do liver ultrasound. If the lesion is in the face or it's segmental in appearance, we need to do echography and MRI of the brain to rule out the other association with strawberry hemangioma, the mnemonic phase. This stands for posterior fossa anomalies, hemangioma, aortic or artery anomalies, S of skin, and E of face, cardiac anomalies, and E of eye anomalies. So for that, if it is in the face, we need to do MRI of the brain in order to rule out posterior fossa anomalies. If there is in the cervicofascial area, we need to do laryngoscopy in order to see that there will be no obstruction of the airway. And if it is in the lumbosacral region, we do ultrasound of the lumbosacral region. So these are the special considerations. So strawberry hemangioma is a dilation of vessels, capillary, is a non-encapsulated, let's say, tumor or proliferation that grows with thin wall, grows at the beginning at birth, and by 6 months the involution begins. Usually to 8 years of age the involution is completely, and we only need to do observation unless the patient has high risk features like visual impairment or airway obstruction, a large facial strawberry hemangioma or segmental, or growing rapidly with ulceration and scarring. We give beta blockers. And for special considerations, that is, we will do a little bit of testing. If there are 5 cutaneous lesions, then in liver ultrasound. If it is in the cervicofascial area, we do otorhinolaryngoscopy in order to see the airway obstruction, that is, if it is present or not. and the posterior fossa anomalies, cardiac anomalies, eye anomalies, arteries anomalies, and strawberry hemangioma is a association that we need to take count.